All right, well, good afternoon. My name is Aaron Lee, and I'm a second-year medical student from the University of Texas Medical Branch in Galveston. And today I'll be presenting our phase 1 trial investigating low-frequency ultrasound as a non-invasive novel therapy for osteoarthritis treatment and aging benefits. So just quick disclosure, our device that we're using is the property of Mechanobiologics LLC. However, none of our investigators or sub-investigators have any conflicts of interest. So low-frequency ultrasound has been shown in cell and tissue models to significantly decrease senescent cell biomarkers. And so our lab has actually gone in and run the mouse data, and we've also been able to reproduce those findings in that model. And so now we're going to go ahead and move on to our human trials, first with our phase 1 efficacy and safety. So age-related disorders like osteoarthritis, specifically for us looking at the knee, are perfect models for this study since osteoarthritis is a common pathology related to the accumulation of senescent cells in those tissues and joints. That accumulation leads to the eventual degradation and decrease of function and pain in those joints. So currently, osteoarthritis of the knee is primarily treated through symptomatic management of that pain and the elimination of senescent cells. And the definitive treatment for osteoarthritis of the knee is total knee arthroplasty. And so in order to try to avoid an invasive procedure like that, we hypothesized that LFU therapy is a novel, non-invasive approach to decrease osteoarthritis complications and to relieve pain and decrease that osteoarthritic damage in those joints. So here we're looking at figure 1. We see a chart of survival of these mice. And so in purple is our line for our LFU treated mice. Those mice are on average able to live significantly longer than our sham group. In figure B, we are looking at spontaneous physical activity through a proxy of wheel rotations. And basically all that is the more times that a mice in old age is able to get up and start exercising on its own, we use that as the proxy for physical health in old age. And so here, looking at all the colored bars, those are our LFU treated mice, and we had a statistically significant improvement in physical health in all treatment dosages compared to our sham. Figure C, we're looking at stains of kidney and pancreas tissues. Those are stained for beta-galactosidase, which is a senescence-associated biomarker. So the less staining we have, the less senescent cells we have. So here we can see that D3 on both the kidney and pancreas are LFU treated, and those have significantly less staining, suggesting that LFU is actually able to penetrate deep into those tissues of the mice and actually decrease senescent cells within the internal organs as well. Lastly, looking at figures D and E, we have D as our control and E as our LFU treated mice. These mice were all 29 months of age. And we can see that in group E, those are all significantly objectively healthier than group A, as you can tell by an increased retention of muscle and body mass, as well as limited balding with fuller and shinier coats. And so the purpose of our phase 1 study is to determine the safety and efficacy of whole body LFU in humans, since this is the first time this has been done. Patients with osteoarthritis of the knee were ideal candidates just because of that aging-related pathology and its general irreversible course. So we included 10 patients aged 40 to 80 years old and who met our inclusion criteria of significant osteoarthritis severity. We tracked qualitative data on osteoarthritis severity through the Lokesny index, pain through our visual analog scale, and we also wanted to keep track of some patient-reported sense of well-being, just to see if they felt like their skin felt better, less wrinkles, just since we are using this as a proxy for overall reduction in aging. And we also wanted to monitor for adverse events, just to see if we had anything related to this treatment causing any bad outcomes. So since this is the first time it's been done, our engineers had to come up with a device. In this case, we used a tub with water as our medium to communicate those ultrasound waves. And this is different compared to your typical point-of-care ultrasound where it uses a probe with gel. We used 8 ultrasound transducers in our tub, positioned to minimize any wave interference. That way, when the patients hop in, their whole body gets an even dosage of that ultrasound. We added safety railings to those steps, and nurses are positioned on the side and directly in front of where the patient gets in, just so we don't have any slips or falls. And our water is chlorinated, heated, and we evacuate the tub and sanitize the entire tub in between treatments. For treatment structure, each patient undergoes 5 separate treatments, each treatment lasting 30 minutes. Vitals are taken before and after each treatment. Consent, weight, and physical exam are done before the first treatment, and questionnaires are filled out before the first treatment and after the last treatment. So looking at our results, they were pretty promising. Granted, this is qualitative and phase 1 trial, but for most of our patients, we saw a significant decrease in osteoarthritis severity and pain. Our mean severity index significantly decreased from an average of 5.75 to 3.15 with a p-value of 0.046. Our mean visual analog scale, and that's proxy for pain, significantly decreased from 1.85 to 0.6 with a p-value of 0.031. Importantly, we saw no major adverse events, suggesting that LFU is safe and it did not cause any significant harm to our patients. We did see a skin abrasion and eye redness. The skin abrasion was from a patient bumping his arm into one of the doorknobs. The eye redness was allergies. So those were both deemed unrelated to the trial and treatment itself. At the individual level, our patients, 7 out of 10 of them reported a complete decrease in pain with no more pain after the treatments. All these suggest that LFU is both safe and effective in managing osteoarthritis. So looking forward, what we're doing next in phase 2, we're going to expand to 50 patients, and we have 2 goals here. Our first goal is to evaluate clinical efficacy with the addition of quantitative measures of osteoarthritis-associated biomarkers from blood and urine samples. I've listed a few of the samples that we're going to be tracking here. And then our second goal is to do a comparative analysis of 2 different powers to see if there are any dose-dependent effects. The 2 powers that we're using are going to be one from the original in vitro and mouse data, and the second one is going to be from our mouse longevity studies. Overall, we are very excited to get phase 2 started. Here are my references and contact information. And I wanted to thank the Cancer Prevention and Research Institute of Texas for supporting our research. Thank you, and I'm open to questions.
Be curious, were folks that you included, so the 10 subjects that you included, were they receiving any concurrent treatment for?
No, they were not.
OA, okay.
Yeah, they were not.
Okay. And then also, could you just talk us through a little bit more relative to the OA severity index? For example, one of your participants who reported no pain on the post-treatment arm, their OA went up to 7 from 4.5, and then they had no pain. So just curious.
Yes, so that's an inherent. So the question was, how do we justify an apparent increase in OA severity, even though the general trend was a decrease? So I spoke with that patient, and it had to do with how the actual Lekesny index is administered. So in the Lekesny index, it asks you for how do you feel over the past 4 weeks. Since our trial only lasts for 2 weeks, that patient got a little confused, and he said that he thought about, oh, how did it feel all the way back at the beginning? And so that was where we kind of went in. Luckily, he was one of the second patient. So we went in and made sure all the rest of the patients knew that just to treat it as the 2 weeks after they got the treatment, just to have a little bit better results. But that does skew our results a little bit. And we are looking at our alternatives for our second phase. We're looking at WOMAC as a different one, but right now we may just stick with Lekesny and just modify it to 2 weeks.
And then just one last question would be, in kind of some of the in vitro and early kind of mouse models, when you found changes in biomarkers of senescence, with what duration and of treatment did that require, and how long were those changes in biomarkers sustained?
Yeah, so for those, I think we've had 3 different publications on that and 5 separate experiments done already, and the multiplication. So I don't remember off the top of my head off of those, but those are all in the publications, in the references. However, the 4 kilopascal and the 8 kilopascals were the ones that were found to be the best in each experiment. So that's why we're going to be continuing to use those in phase 2. In phase 1, we specifically just used the 4 kilopascals because we didn't want to overdo it with too much intensity. So we wanted to make sure the baseline one was the first.
Baseline.
Are they able to tell that they're experiencing low frequency ultrasound. I asked, is it possible to put people in a placebo bath?
Yes. So the question was, can people actually tell if they're getting the treatment, and would that interfere with any double-blind placebo-controlled studies, right? So for this, our ultrasound emitters actually emit a low-frequency chirp. So when you're laying back in the tub and your head is next to the emitter, you can hear it a little bit. And so our engineers have already gone to address that. In the new version of the tub, we're going to be starting phase 2 with version 3. Those emitters, instead of being over the top of the tub next to your head, they will be put underneath the tub. That way, no one is able to actually hear them going on. And since it's such low frequency, you are not able to see any rippling in the water either. So we've addressed that to say placebo control won't be an issue in the next phase.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.